Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about Bartonella. Bartonella is a gram-negative bacteria that we frequently see as a co-infection with Lyme disease, Babesia, Ehrlichia, Rocky Mountain spotted fever, etc. It is a bacteria that takes up residence along the endothelium of your blood vessels. So what else do we see that damages the endothelium? SARS-CoV-2. So SARS-CoV-2 and Bartonella both cause endothelial damage, which is why patients that have Bartonella, when they get COVID, they oftentimes are really sick and they have poor vascular function and poor blood flow. Bartonella is also known as cat scratch fever. So you can get it from a scratch from a feral cat, an outdoor cat, but you can also get it by a variety of different blood-borne vectors like ticks, mosquitoes, fleas, spiders, sandflies, and it is quite a problem among the homeless population and those that use intravenous drugs because it's pretty contagious. You can get it fairly easily. So the reason that I bring this up is that Bartonella is not a very well understood or studied bacteria, and yet I would say 85% of my patients in my practice have Bartonella, including myself. And I got mine in Westport, Connecticut when I got Lyme disease. But my point is that Bartonella is ubiquitous. And there's probably more than 30 species that are pathogenic. It was first noted by a Peruvian scientist, and they found it in a human being's tooth that was 4,000 years old. So Bartonella has been infecting humans for centuries, and we've only recently developed the science and the capability of identifying the organism as well as identifying the antibodies that the human body produces in response to the infection. So I said the infection largely takes up residence in the endothelium, which is the inside of a blood vessel. And about every 5 days, some of the Bartonella gets released into the bloodstream and then infects your red blood cells. And it can also be known as hemobartonella. Heme meaning blood, Bartonella is the infection. So it's just one of those really nasty infections that can really wreak havoc. And one of the hallmark signs, although not everybody has it, is stria, S-T-R-I-A. And they are large track marks on the abdomen, the back, the thighs, even on the inside of the arms that are readily noticed. And they are mistaken for stretch marks. They are not stretch marks. Stretch marks are not red. So Bartonella stria are generally red, and with treatment they fade and they end up being kind of a silver color like stretch marks. Bartonella can infect all of the different organs. It's known to cause severe neuropsychiatric symptoms like anxiety, depression, psychosis, schizophrenia, bipolar. It really does a number on the brain because it readily crosses the blood-brain barrier and gets up there and causes severe neuroinflammation by producing pro-inflammatory cytokines. We do have treatments for Bartonella. The one that's the best so far is Methylene Blue, which is a dye. And Dr. Horowitz is working on the Dapsone protocol, and that also may be useful for Bartonella. But other drugs like Zithromax, um, Bactrim, minocycline, rifampin, Biaxin are very useful in lowering the pathogen load of Bartonella. And the herbs that we use are Houtynnia, Japanese knotweed, black walnut, and garlic. I sometimes use thyme. In some people, thyme works great. Another one is oregano, and the product biocidin is very helpful at um, lowering the pathogen load of Bartonella. I generally use a integrated medicine approach for Bartonella because Bartonella has persister cells just like Lyme, and uh, you have to get at the persister cells, which are inside the biofilm. Bartonella is a big biofilm producer, and it lives in biofilm, so it's rather difficult to get to. You have to sort of scrape away at the biofilm as well. Although methylene blue penetrates the biofilm, and that's why it's one of the preferred drugs. So I'd like to leave you with this. I've had Bartonella for 24 years, and I lead a very, very normal life. I have to sometimes go on and off antibiotics because I'll relapse when I have significant oxidative stress, like an accident or the death of my dog. That also caused me to relapse. But you go on antibiotics or herbs for 3 to 6 months, you get it back under control, and then you largely control it through nutrition, through your diet, and through some supplements. So it's not a death sentence. And I want people to know that it can be handled with proper treatment, usually integrated, and nutrition, and you can have a very wonderful, happy life. So I hope this information helps you, and I hope you have a wonderful day. Thank you.